Hello, my name is Zara Ahmed, and today I'll be talking to you about my Keystone project, where I looked at patient-provider relationships, specifically in Asian and Hispanic populations. So first, here's some quick background on patient-provider relationships. A patient-provider relationship refers to how well a patient and their medical provider communicate and relate to each other. This is an important area of research to explore. Historically, medical providers have had almost complete authority in patient-provider interactions. However, as healthcare has modernized and patient rights have grown, it's important now for patients to have more autonomy when it comes to medical care and decision-making. A high-quality relationship is important to making sure that patients are informed and able to work to maintain or improve their health. Past research has found that high-quality relationships have led to positive patient experiences, more patient satisfaction, an increased adherence to treatments, and better patient outcomes. In America, where there are obvious disparities in healthcare, whether it be due to race, socioeconomic status, gender, etc., patient-provider relationships can be a way to work towards lessening the gap in care. So here's some quick background on Asian Americans and Hispanic Americans, the two populations I looked at for my project. It's important to study these groups as they continue to grow relative to the U.S. population. As you can see on the slide, according to population projections, Asian Americans are the fastest growing racial minority group in the country. Hispanic Americans are a large ethnic minority group in the country and are projected to grow as well. It's important to note when it comes to discussing these two populations that these groups tend to face problems of cultural competency and language barriers when it comes to communicating with their medical providers, making them important groups to study. Providers should be able to have conversations with their patients in order to better understand their patients and deliver care respectful to a patient's culture. Language barriers are also important for providers to work around, since they are a large barrier to care. About 1 in 5 Latinx Americans will actually not seek care due to a language barrier. This statistic just illuminates the importance of working to overcome these barriers for providers. So the main reason I focused on different racial and ethnic minorities and how they relate to the provider for my project is because there's little to no research in this area. I chose to focus on those who identify as Asian or Hispanic Americans, not only because of their growing numbers in the U.S., but because these groups are understudied. Most studies regarding patient-provider relationships and race will look at white patients or those who identify as Black or African American. It's important for research to look into the perceptions of other patients' relationships with their providers as well, in order to help inform providers about where they might need to improve. This is especially important for these minorities who might face more barriers when it comes to healthcare, as I had mentioned earlier. So, to look into this, I asked the question, how does the patient-provider relationship look for Asian Americans and Hispanic Americans? To study this question, I used an online quantitative survey to collect my data. The questionnaire I used was the PDRQ-9 from a study called a Patient-Doctor Relationship Questionnaire in Primary Care, Development and Psychometric Evaluation. I chose to adopt this standard into my study so that way data could be comparable if need be. It was also helpful to use a validated measure because that way I knew there had been past success with the questionnaire. So, on the slide you can see the questions asked and what the possible responses were. The prompts asked about trust, dedication, communication, accessibility, and more. And patients could respond to the prompts with anything between not at all appropriate and totally appropriate on a scale of 1 to 5. I added in demographic questions to ask about race, provider type, and other qualifications for the study. I chose to ask participants about their relationship with their primary care provider or their PCP. It made the most sense to ask about patients' relationships with their PCP because a PCP is the provider type of person most likely had a visit with in the past. The participants I reached out to were from the greater Boston area, which is a geographic limit on my survey. Quickly, before I discuss my results, I just want to note that in my project, Any participant that self-identified as Asian American or Pacific Islander was classified as Asian American, and anyone who checked off white and Hispanic or Latinx was classified as Hispanic. The results of the research are shown on the next two slides. As you can see, average responses for Asian Americans tended to fall in between a 3 and a 4, or appropriate and mostly appropriate. The highest average response was, "I feel content with my PCP's treatment," and the lowest response was, "My PCP understands me." On this slide, you can see the responses of those who identified as white and Hispanic or Latinx. These participants tended to respond a bit more favorably, with their average responses falling between 4 and 5, or mostly appropriate and totally appropriate. The highest average response was, "I find my PCP easily accessible," and the lowest was, "My PCP helps me." Based on these results, we can see that understanding and help were rated as the lowest outcomes. While it's a good thing that responses were generally rated as appropriate, or number 3, that does not mean that there isn't any room for improvement. The highest responses involved contentment with treatment and accessibility of the provider, both very important aspects to care. The lowest responses involved help and understanding. These are both incredibly important areas for providers to acknowledge when delivering care and communicating with their patients. One of the main responsibilities of a medical provider is to help their patients. If for some reason a provider doesn't seem to be helping them, that can mean the patient doesn't feel entirely comfortable with their experience. Patients are also less likely to feel understood according to this data, which could lead to problems with comfort in sharing problems with their providers. These are both important areas that should be explored to see how providers can work to better help and understand their patients and hopefully improve communication. Ultimately, the goal of this research was purely exploratory. I wanted to look at what the responses of these populations would be. I went into the project with really no way to guess what the results would be. Because this research was basic, the project can be built off of in so many different ways. Follow-up research could be done to try and explore what determines what a patient might value in their patient-provider relationship. Qualitative research could be done by interviewing patients and asking more open-ended questions, something I wasn't able to do in my project. Researchers could also look into seeing how providers perceive their relationships with their patients. Overall, since patient-provider relationships are a relatively new field, any new research is important to seeing what providers can do for their patients. I hope to see this field of research grow. Practitioners have a responsibility to understand their relationship with their patients in order to provide better care. Racial minorities have always been at a disadvantage in our healthcare system, and that has yet to really change. More research asking minorities these important questions will empower more patients and give them a voice in a conversation that they need to be a part of. Thank you so much for your time, and quickly before I go, I would like to thank my advisor, Sophie Godley, in the School of Public Health, and the Kilachand Honors College for supporting this Keystone project. Thank you for listening.